chronic obstructive pulmonary disease. Every year in the month of November, World COPD Day is celebrated actually. This year it falls on November 20th, and today we need to know what is COPD, what are its symptoms, how can it be prevented, what are the treatment options which are available to that. As we know that respiration is a very important process our lungs take care of. When we breathe in air, the oxygen from the atmosphere enters into our breathing passages, and from the breathing passages it goes into the lungs. In the lungs actually we have tiny sacs which are called as alveoli, and these alveoli or air sacs also contain blood vessels adjacent to them. When the air comes into the alveoli, the good air or the oxygen from the alveoli or the air sacs go into the blood, and the bad gases like carbon dioxide which are there in the blood circulation come into the alveoli from the blood circulation. And this is an important act which is carried out by the lungs, and this is important for supplying oxygen to the every cell. So if this process stops, the energy generation process stops, and then we cannot live. So this important process is sometimes, the important process of respiration is sometimes hampered by things like smoking and exposure to smoke. So what happens when we smoke? When we smoke, it leads to inflammation in the airways, and this inflammation leads to swelling of the airways, which leads to narrowing of the airways. So it becomes difficult for us to breathe, and sometimes the alveoli or the tiny air sacs which I mentioned also become enlarged, and they join and become large sacs, air sacs, which are called as emphysematous areas. We have two types of COPD. One is called as a chronic bronchitis, in which the air passages become narrow, and the other form of COPD is called as emphysema, where the air sacs are becoming larger in size. Most of the patients have a combination of both COPD and emphysema. So when a person gets exposed to the smoking or some kind of exposure like cooking using gobar or cooking using wood, this leads to accumulation of the smoke in the room, and thus leads to this kind of inflammation and emphysema. So when a patient develops COPD, he has chronic cough, and there can be production of sputum, which is nothing, also called as phlegm in common language. This phlegm happens on most of the days, at least in 2 or 3 consecutive years actually. So if the person has this kind of symptoms for more than 2 years, it is said to be called as chronic bronchitis. And some patients also develop breathlessness. This breathlessness happens predominantly when a person is walking, when a person has to climb stairs, when a person has to carry any weights, and when the disease progresses, even on day-to-day activities like taking bath or picking something from the market. All these routine activities also become difficult, and patients develop breathing difficulty in all these activities. So when the disease becomes even more severe, the patients become oxygen dependent, and their activities are limited, and they become bedbound and homebound actually. So the only way to prevent COPD is to not take the first cigarette or the first smoke actually in smokers. 90% of all COPD occurs because of smoking, and rest of the 5 to 10% of cases are because of cooking with using an gobar gas, or cooking with an wood, or some kind of occupational dust exposures like coal dust exposure or mining exposure. So avoiding exposure to these smoking and avoiding exposure to this kind of occupational exposures is the key to preventing COPD. Once the disease occurs, there is nothing else which we can do. We can only control the symptoms. There is no permanent cure for COPD. We can only alleviate the symptoms which are happening to the patients. And the other thing which we can do for patients is to give inhalers, which help them breathe better, and their breathlessness decreases, their cough decreases, and the phlegm decreases. And these patients require vaccinations every year. These patients are prone to infections like viral infections like influenza and bacterial infections. So we have 2 important vaccines which are available, which are called as influenza vaccine, or the flu shots, commonly unpopularly called as, and pneumococcal vaccine, which can be given to the patients to prevent recurrent infections in a patient. For patients who become dependent on oxygen, oxygen needs to be given actually, and this improves the quality of life of the patient and also improves the survival. So for smoking cessation or stopping the smoking, different options are available. The first, the patient needs to be motivated enough to stop smoking, and then we have medical options which are called as nicotine patches or nicotine gums, which are given to the patient to avoid cravings and withdrawal symptoms. Most patients would like to stop smoking. However, because of these cravings and withdrawal symptoms, the patients cannot stop and go back to smoking. So even when the patient is diagnosed to have COPD, stopping smoking has been shown to be beneficial and has been shown to improve the survival and improve the quality of life. Stopping smoking is an important thing which everyone should consider doing it, especially when they develop COPD. Even before developing COPD also, we need to consider this very actively. And the other treatment options which are available for patients with COPD are pulmonary rehabilitation. Pulmonary rehabilitation is nothing but a comprehensive exercise program wherein the person is taught how to breathe well, and they are given breathing exercises, and they are given graded exercises to the both upper limbs as well as the lower limbs, and this helps them breathe better. It has been shown that increase in the strength of upper limb muscles and the lower limb muscles has been shown to decrease the breathlessness and the perception of breathlessness in patients. And if you train your breathing muscles, even the breathing breathlessness also decreases. So these are some of the important options which are available for patients with COPD. If a patient is having a progressive disease in spite of all these inhalers, oxygen therapy, pulmonary rehabilitation, these patients become a candidate for lung transplantation, and either a person can undergo single lung transplantation or double lung transplantation. These are the options which have to be considered and kept in mind for patients in the long term. Thank you all for a patient listening.